What if the next law passed in Washington could completely change daily life for millions of senior citizens across America, and hardly anyone is talking about the details yet? Just moments ago, the Senate approved a major new law that could directly impact Social Security recipients, retirees, low-income seniors, Medicare beneficiaries, and families already struggling with rising costs in 2026. And now, people across the country are asking the same urgent question: will this help seniors or create even more pressure? For many older Americans, every dollar matters right now. Grocery prices remain high, prescription costs continue climbing, housing bills are becoming harder to manage. And with inflation still affecting fixed incomes, millions of seniors are watching Washington more closely than ever before. But this new Senate-approved law may introduce changes that could affect benefits, eligibility rules, healthcare access, retirement support, and government assistance programs in ways that most people do not fully understand yet. Some lawmakers are calling this one of the biggest senior-focused policy changes in recent years. Others are warning that the real impact could take months to unfold. That's why today's update is so important. In this video, we're breaking down exactly what the Senate approved, who could be affected first, what it means for seniors across the United States, and the key details every retiree and family member should know right now before new changes begin rolling out. So, before we begin, make sure you like this video and stay informed, because the updates coming next could directly affect you or someone you love. The reaction across the country has been immediate. Senior citizens, retirees, caregivers, and even younger Americans planning for retirement are all trying to understand what this newly approved Senate law could mean for their future. Phones have been ringing at Social Security offices. Online discussions are exploding. Community centers are hearing questions from worried seniors who want clear answers. And while headlines are calling it a historic move, many Americans still have no idea how deeply this legislation could affect everyday life. What makes this moment so important is that millions of seniors are already under financial pressure. Over the past few years, retirees have watched the cost of groceries rise faster than expected. Utility bills have climbed, rent payments and property taxes have become harder to manage. Even basic essentials that once seemed affordable now force many older Americans to carefully calculate every dollar they spend. For seniors living on fixed incomes, there is very little room for surprise expenses. That is why this Senate-approved law is getting so much attention tonight. According to early discussions surrounding the bill, lawmakers focused heavily on concerns that seniors have been raising for years. Many retirees have argued that benefit increases have not fully matched the true cost of living. Others have complained about delays, confusion, and rising healthcare expenses that continue eating away at monthly budgets. Families caring for aging parents have also spoken out about the growing difficulty of balancing caregiving responsibilities with work, bills, and daily life. This new law appears to address several of those frustrations at once, which is why supporters are calling it one of the most significant senior-related developments in recent memory. At the same time, not everyone is celebrating yet. Critics are already warning that some parts of the legislation may come with long-term consequences. Some economists are questioning how certain provisions will be funded over time. Others believe the law could create administrative challenges if federal agencies are not prepared for sudden changes. And many seniors themselves are saying they simply want facts instead of political promises. They want to know whether this law will actually put more money in their pockets, improve healthcare access, or reduce the financial pressure they feel every single month. That uncertainty is exactly why so many Americans are paying close attention right now. For people already relying on Social Security, SSI, SSDI, Medicare, or retirement savings, even small policy adjustments can make a major difference. A change in eligibility rules, payment schedules, healthcare support, or income thresholds can impact how seniors plan their budgets, manage prescriptions, and cover housing costs. And because this new Senate-approved law appears connected to multiple areas affecting older Americans, millions are trying to understand whether they should prepare for positive changes or possible complications. One of the biggest topics surrounding the legislation involves the growing concern that seniors have fallen behind economically, despite decades of work. Across the country, retirees are sharing stories about having to cut back on food, delay medical appointments, or continue working far longer than they originally expected. Some seniors thought retirement would finally bring peace and stability, only to discover that rising prices have forced them into constant financial anxiety. Lawmakers behind the bill claim the new measures are intended to respond directly to those struggles. Several reports discussing the legislation suggest that lawmakers spent months debating how to strengthen protections for older Americans, while also responding to pressure from advocacy groups demanding faster action. Senior organizations have repeatedly argued that inflation has changed retirement in ways many politicians underestimated. What used to be manageable monthly expenses now create overwhelming pressure for people dependent on fixed checks. Even small increases in healthcare costs can force difficult decisions between medication, food, and transportation. The emotional side of this issue is also becoming impossible to ignore. Many seniors feel exhausted after spending their lives working, raising families, paying taxes, and contributing to their communities, only to now feel uncertain about financial security during retirement. For some older Americans, this law represents hope that government leaders are finally recognizing how serious the situation has become. Others remain cautious because they have seen promises made before without meaningful long-term improvements. Meanwhile, families across America are also watching closely because the effects may extend beyond retirees themselves. Adult children helping aging parents could experience changes in caregiving support, medical coverage, or financial planning responsibilities. Healthcare providers may also face adjustments if new policies alter reimbursement systems or patient eligibility. Financial advisors are already discussing possible implications for retirement planning strategies depending on how quickly federal agencies begin implementing the legislation. One major concern many viewers have right now is timing. Even though the Senate has approved the law, people want to know when changes might actually begin. In Washington, legislation often takes time before Americans see real-world results. Agencies may need months to organize new systems, process regulations, and communicate updates. That means seniors should remain alert because implementation timelines could vary depending on which parts of the law move first. At the same time, experts are warning Americans not to panic over rumors spreading online. Social media has become flooded with exaggerated claims, confusing interpretations, and misleading headlines about what this law supposedly includes. Some posts claim massive benefit increases are guaranteed immediately. Others predict severe cuts or dramatic disruptions. The truth is likely more complicated, and that is why accurate information matters now more than ever. Another important issue involves healthcare affordability. Many seniors say medical expenses are one of the biggest reasons retirement feels financially unstable. Even with Medicare coverage, prescription costs, specialist visits, insurance gaps, and out-of-pocket charges can create enormous stress. Lawmakers supporting this legislation argue that parts of the bill are intended to ease those burdens and improve access for vulnerable seniors who have struggled to keep up with rising healthcare expenses. For retirees living alone, the situation can feel even more overwhelming. Across the country, many elderly Americans are surviving month to month with very limited support systems. Some rely almost entirely on federal benefits to cover basic living expenses. When prices increase suddenly or unexpected medical bills appear, there is often nowhere else to turn. That reality has pushed many advocacy groups to demand stronger protections for older citizens. What has shocked many observers is how quickly public interest in this Senate decision has grown. Within hours of the announcement, online forums, community groups, and retirement discussions began filling with questions from concerned Americans. People are asking whether monthly payments could increase, whether eligibility rules may change, and whether additional support programs could follow. The uncertainty itself has created enormous attention because millions understand how much is at stake. Some lawmakers are framing this legislation as a response to a broader retirement crisis slowly developing across the United States. They argue that traditional assumptions about retirement no longer match modern economic realities. Decades ago, many workers expected pensions, affordable health care, and manageable living costs during retirement. Today, many seniors face rising debt, shrinking savings, and uncertainty about future economic conditions. Supporters of the bill claim stronger federal action became unavoidable. Critics, however, continue questioning whether the government can realistically sustain expanded commitments without creating financial strain elsewhere. They warn that while immediate relief may sound appealing, long-term funding challenges cannot be ignored. Some analysts believe future debates over taxes, federal spending, and entitlement programs could become even more intense because of measures connected to this legislation. Still, for many seniors watching tonight, the political arguments matter less than practical reality. They care about whether they will be able to afford groceries next month. They care about whether prescription medications will remain accessible. They care about whether housing costs will continue consuming larger portions of their retirement income. And they care about whether government leaders truly understand the fear many older Americans experience when living on limited resources. There is also